Today is Sunday, November 1st, 2020. Welcome to Ayush Hard Talk. I'm Dr. Bhaswati Bhattacharya in Udupi, India right now. And I'm here with a panel of colleagues who are going to discuss with us today a very, very tough topic for many people, that is, does homeopathy work? As a medical doctor, I hear many allopathic doctors say homeopathy is only a placebo. I hear several people in other parts of life who are not health professionals say, well, I thought homeopathy doesn't work. It's just water after all. It's just a sugar pill, right? There's a lot of ignorance about homeopathy. And yet there are people who will say, I got better using homeopathy and I swear by it. And I will only live in a place where I have access to homeopathy. And we have such a polarized view of homeopathy that we at Hard Talk thought it would be good to discuss it. With me today are three practicing homeopaths. Dr. Ratin Chakravarthy from West Bengal, who has been practicing his whole life. His father was also a doctor and homeopath, Dr. Bholanath Chakravarthy. And Ratin has been practicing for the last several decades. And in addition, he was the mayor of one of the sister cities of Kolkata named Howrah. So he was the mayor homeopath of that town for several years. Welcome, Dr. Ratin.
Hello, Bhaswati and everybody.
Yes. We also have Dr. Jayesh Sanghvi, who is originally from Gujarat, spent a lot of time in his childhood in Kerala, and is now in Chennai at the Nature Clinic. He has been practicing homeopathy for several decades as well, and is a consummate clinician. He has many, many patients that he's treated with all kinds of incurable cases, which he and I were chatting about and we'll talk about more, including cases of cancers and various infertilities and incurable diseases. So welcome, Dr. Jayesh.
Thank you, Dr. Bhaswati. Thank you.
And Professor Dr. Rajendran E.S. is from Kerala, practicing, and is very much a researcher of technology, a practitioner, and an author. He has authored 7 books and written numerous articles, and is here with us today to talk about not just how homeopathy works clinically, but how it also works in terms of its basis. So welcome to you, Dr. Rajendran. So I want to start out by having each of you talk about, and this will be a discussion, not a series of presentations. I'd like to start out with each of you talking a bit about the history of homeopathy in India, since obviously we know that it's not one of the quote unquote Indian traditional sciences, or is it? Let's start with Dr. Rajendran.
Yes, Dr. Bhaswati, thank you so much for organizing such an evening for exploring what is Irish and what is homeopathy. Homeopathy indeed is not an Indian system, but it became an Indian system in the course of time. And also part of Ayush ministry composed of Ayurveda, yoga, Unani, Siddha, and homeopathy. And homeopathy is one of the sister concerns of Ayush, because in India it is being considered as an Indian system of medicine right now, because people love homeopathy so much. And the practitioners are around the country, and in every city, every villages, there are homeopathic practitioners, serve the people, and they give great service to the humanity. And they serve people who, as you said in the beginning, many a time branded as incurables and branded as difficult to cure for chronic patients without having much help, are being helped and cured by doctors like Sanghvi, doctors like
Rajendran, I've taken the permission to interrupt you to keep this going. I'm just going to keep it focused on the question. Dr. Ratin, could you please talk about the history of homeopathy and an Indian traditional system, or is it, as Dr. Rajendran says, something that's become beloved by the Indian people, and that's why we've included it in Ayush?
It's right, Bhaswati, and all our august viewers. It's a very important question. It is no doubt, though it is considered as an Indian system of medicine, but the origin of homeopathy is actually in abroad, and basically it is in Germany. As we all know, Dr. Samuel Hahnemann, he was a German person, and he's one of the disciples. He came in India long back in 1850s, possibly, no, in a 17th century end, and he came to India to treat Maharaja Ranjit Singh of Lahore. And then his name was Dr. Hanik Barger. Later on, he came to Calcutta, and there he started treating the elites of the then Bengal, and the then elites of Bengal was very much impressed on this system of medicine. Many people, including Ishwar Chandra Vidyasagar, Kavi Guru Rabindranath Tagore, and many elites of India, they took up the homeopathic system of medicine at that time. And gradually, it became very popular. But the most important thing which I want to focus on, that it's the hard talk. The hard talk is focused on whether homeopathy works. The establishment of homeopathy, there is a story which I narrate. It will definitely, certainly convince our viewers and also a lot of people that yes, homeopathy works. In the 1971, when the Bangladesh war, the India-Pakistan war broke out, at that time, lot of people, they came as political, to take political asylums in India, and in this particular camp, the cholera outbreak took out. And there, at that time, the Bengal homeopaths and the most leading homeopaths of India came forward, and they started treating the cholera patient, and this camp became very popular over there. All these data was gathered together, and then it was forwarded to Government of India. Then a committee was formed by the Government of India, which comprises of 42 parliamentarians of India, headed by Professor Omyo Kishku and Professor Rongo. They were eminent professors of and parliamentarians over there. They came over there, they evaluated the entire matter, they evaluated the entire data and history, and found that yes, homeopathic system is equally potent and capable of delivering goods in the acute conditions, in the epidemics like cholera and on this system. The entire data was then forwarded to Indian Parliament and Lok Sabha, and which was placed over there, and then the then health minister was Professor Dr. Karan Singh, and he placed the entire matter as a bill in front of the parliament, and the parliamentarian, the 545 parliamentarian was convinced that yes, homeopathy works, and without a single opposition, the Indian parliament passed the homeopathic system of medicine and recognized this thing. So this is one of the important points, which is the issue of our hard talk, that whether homeopathy works or not.
I'm going to come back to you on this because I just want to pull in Dr. Jayesh's view on the history before we continue with some of this evidence.
Sure, definitely.
You had mentioned to me something about Sukshma Ayurveda, which was learned in Maharashtra or Gujarat some years ago. Can you talk about whether or not there's any basis to the Sukshma Ayurveda as a lead for homeopathy?
Yes, Dr. Bhaswati. The Sukshma Ayurveda, I think, was practiced somewhere in Ahmednagar, Maharashtra, in the early part of last century. And Sukshma Ayurveda, I read a little bit on that. It is so similar to the homeopathic theory of trituration and potentization. You know? So you had one portion of the medicinal substance, like 9 parts of the vehicle, non-medicinal vehicle, lactose, and then being triturated for 2 to 3 hours. That's what Sukshma Ayurveda says. And the same thing was in homeopathy. The decimal potencies were all triturated. 1 portion medicinal substance, 9 portions of lactose as the non-medicinal vehicle, and triturated for a certain period of time. So the dormant energy of the substance was awakened in that process. And there is such great similarity between both.
This idea of dormant substance, can you talk a little bit about what this dormant substance is that makes homeopathy work? You can begin, Dr. Jayesh, and then I'll come to the other panelists.
Yeah. When you see the dormant energy, we have a lot of inert substances. In homeopathy, especially, you have sand, you have the rays of the magnet, you have the X-rays, you have the moon's rays. Now, all these medicines have been converted into a homeopathic, into a medicinal. I think, if I'm not wrong, Ayurveda says that every substance on earth has medicinal properties if you know how to go about awakening those properties, right?
That's
Or activating those properties. And that's where this concept of Sukshma Ayurveda or trituration comes in. That process of triturating the substance for 2-3 hours, brings out a certain dormant energy. I often give the example of, in our ancient scriptures, they have mentioned where the Danavas and Daityas churned the ocean and turned poison into nectar, right?
yes.
This concept of trituration or dilution in homeopathy, potentization, what we call in homeopathy, is very similar to that. So when there is an intermolecular reaction, we have the theory of potentization, for example, where you take one portion of the medicinal substance, like a portion of alcohol or non-medicinal alcohol, and that particular bottle containing this 1:100 dilution is given 10 proper jerks at a certain force. Now it is done with machines also. Now, when that happens, there is a friction between the molecules of the non-medicinal vehicle, which is the alcohol, and the medicinal substance. When this friction happens, when you rub your hand, what happens? A certain energy is liberated, right? So when these molecules of the medicine and the non-medicinal vehicle, which is the alcohol, have a friction against each other with those proper, solid jerks that are given, a certain energy is liberated. And we say it is this energy which which sort of strengthens your body's immune force or immune system, the vital force, we call it in homeopathy. And the vital force, when it weakens, is when you get a disease. And so when you have an energy as subtle as the vital force regains the strength, and the body knows how to correct itself and heal itself. So that is the whole concept of.
Thank you very much, Jayesh. We'll come back to you. Dr. Rajendran, I saw you very excited to also pipe in about this idea of potentization or succussion. If you can talk about nanoparticles or even just the idea of dilution. How does it work, sir?
Yeah, Dr. Bhaswati. This is something which was very controversial in the beginning of homeopathy. When he discovered homeopathy in 1790, he had a plan to have a completely integrated material science and homeopathy in material doses. That was his initial stages of homeopathy. And somewhere in 1810-12, Hahnemann started potentization process, which Dr. Sanghi has just explained, to take the medicinal substance and the vehicle and make for trituration or dilution as a serial process. And Hahnemann has gone up to 30th dilution. It's called 30C. Where the dilution factor is 1/10 to the power of 60. And which was working well. And this potency was used for drug proving in human beings as well as for the prescription in patients. So this went on like that. Then later Hahnemann's disciples started increasing the potency and dilution to 100, 200, 500, 1000 range. Then Dr. Hahnemann told them, it's not nice to dilute like that. There is no chance of any material content in that. So better not to do that. He said, you go up to 30C and that is the end of it. But after many years, in 1890, his disciples came back and told Hahnemann, we are getting marvelous results with the dilutions of 200, 500, 1000, etc. So he got convinced. He said, okay, definitely you can use the higher dilutions. So that is where the higher dilution started the common practice of homeopathy around the world. And every time from the beginning itself, there was a confusion. This is just a water solution and there is a placebo, and definitely this is not a medicinal solution. That is what the basic physics and chemistry talked as per the Avogadro's principle. So this was a controversial issue all along. And the first breakthrough on this issue came in 2010 when the first paper on the electron microscopic analysis and SAED analysis of 6 metallic drugs done by Mumbai IIT team by 𝐃𝐈𝐻 and Professor Ayush Valley and their team discovered there are presence of nanoscale particles up to 200 C dilution in metallic drugs. I started my work in 2011 as a follow-up work of what Dr. Ayush Valley and the team did. And I started studying drugs beyond 200 dilution. 1000 C, 10,000, 50,000, 100,000 dilution. So principally, theoretically, there is no possibility of any molecule in that. So, but I was curious to know about it. So I utilized 2 electron microscope, transmission electron microscope and field emission scanning electron microscope attached with X-ray spectroscopy, that is energy dispersion spectroscopy. And I studied continuously last 10 years, more than 200 samples with these 2 equipments plus dynamic light scattering. And what we found is very exciting, and initially it was unbelievable, but later it is been known to us, it is a fact that all these high dilutions contain nanoscale particles of the original drug substance, even in the highest homeopathic dilution. And as Dr. Ayush was telling, when homeopathic preparation goes, now when the nanotechnology arrived in the scientific world in the last 40 years, we know that nanotechnology used the technique called top-down nanofabrication for producing nanoparticles. In fact, in homeopathy, trituration is a process which is very, very similar to the top-down method of nanotechnology.
Thank you, Dr. Rajendran. It's very difficult. If you could just put on your head, that will be really useful for us because we want to hear everything you have to say. And while you're doing that, I will ask Dr. Ratin. Dr. Ratin, you've also been doing a lot of research. Can you talk to us a bit about why that dilution should be potentizing and not diluting, as the pharmacologists say, because they have a log dose. Well, I should say we, because you're also a trained allopath, but we talk about pharmacology as log dose responses, and homeopathy talks about potentizing with dilutions. Dr. Ratin?
Yes, actually, absolutely, I agree with Dr. Rajendran. The first breakthrough came from IIT Mumbai, and prior to that, I would like to point out to one of the research work, which is very important and which was done and conducted by in collaboration with School of Tropical Medicine and CCRH Calcutta. They basically did this research, and it was basically the first research work in homeopathy which focused on the biological activity of homeopathic drugs which are present over there. That was shown in this research work. And this is this collaborative research. They've done this research in vitro and in vivo model, and where they have done in first with the cheek chorioallantoic membrane model, and later on in vivo they done on the suckling mice model, and where they have absolutely found that the homeopathic belladonna, they are capable of reducing the viral load of the Japanese virus encephalitis in both the models, and they are very successful. Later on, these studies was published in American Journal of Infectious Diseases, in International Journal of Microbiological Research, and where they have categorically shown that this is the reproducible thing. And where they, in this study, an interesting thing was observed that it is no doubt about it. At that time, the Professor Bilary's work was not present, not available at with the School of Tropical Medicine. But the interesting thing is, the dilution part is very important, where the substance is containing the nanoparticles. We require some sort of like debulking or dilution, because these nanoparticles are quite toxic enough in that way, which can also was creating problem to the suckling mice, and the state of the suckling mice was dying when the dilution was not done. So this is very important, and it is one of the important area. We require dilution as well as we require potentization. And definitely it is my personal belief that homeopathy shares lot of its principles with basic Ayurveda.
Well, thank you for saying that. I will point out, I spoke with Dana Ullman, who was going to join us, but it's 3 a.m. in California, so he didn't. He mentioned there was a study that was done that showed that when a substance is diluted, so you take a mother tincture, you take a water preparation of some substance with a particular concentration, it's called a mother tincture, and you take a shake of that, as you said, 10 times, and then you take one part of that and add it to 99% of double distilled complete clear water. So it's a 1 to 100 dilution, that's called 1C. And then you take that and shake it 10 times, and you take one part of that and add it to 99 parts of double distilled water. One of the things he said is that it had done by Hahnemann. Apparently Hahnemann tried different kinds of containers, and I didn't hear any of you mention this. It was always done in glass. So glass is made of silica. Computers and memory chips have a ability to be polarized by their electrons because of the silica. And what they found in recent times is that when it's potent in that glass vessel, the metals especially tend to move against the side of the glass and stay there, and therefore they create a certain kind of electrical force, an electromagnetic force. And so this to me is very interesting as a lover of metals, as a studier of Rasa Shastra. So you guys have been talking so far about metals and dilutions. I'm wondering if Dr. Jayesh can share the case of a metal being used in a clinical setting, the case that you shared with me earlier, Dr. Jayesh.
Yes, this was a very interesting case. This was a lady from Dubai, Russia, Russian lady, who had a unicordiate uterus. So there is only, the uterus is less than half the size of what it should be, only one fallopian tube. And in her case, the uterus was far smaller than even a normal average unicordiate uterus that a person would have. And she was told by the gynecologist that she can never conceive. If she ever does, she would abort in a maximum of 2 to 3 weeks. So this lady had contacted and wanted to see if homeopathy could do anything. I said we will give it a try. Well, it coincidentally happened that the day she called me, she had conceived. She had wanted help to conceive. And I said, before you conceive, I need 6 to 12 months to work upon your uterus. Now, what happened is, she said, I've conceived. And the gynecologist was very upset with her. He said, you're harming your body. I've told you not to conceive. And you will not pull on more than 2-3 weeks. Coincidentally, we sent the homeopathic medicine from here. Her person was in Chennai. She started the medication. 2 weeks, 2 months, she went full term, and the child is 8 years old now. The medicine given to her was Ledampal. It is, Plumber Met, which is lead in homeopathic form. It's a potentized form, what we call a 50 millisievert potency or a LM potency. 0/3 was given to her, and that helped the uterus get strength. The uterine muscles got enough strength to expand as the fetus grew, and she went full term. The doctors to this day express surprise. They said, we never in our life have ever seen a case of unicordiate uterus conceive and deliver a normal healthy child. So that is about the metal, Dr. Bhaswati.
And in fact, we discussed that Nag Bhasma, which is lead also, in the Bhasma form, also provides flexibility to tissues. So there is some kind of physiologic basis for this happening. But the biggest part is that homeopathy is known for curing cases that modern medicine has called incurable. So Dr. Rajendran, can you talk about some of the situations where you've seen the things that are absolutely incurable by scientific medical evidence that you have seen in your clinical practice to be not incurable?
Yeah, I have a recent example of last 1 year back, a patient who had a slow virus infection many years back, and he had gone through a very bad state of physical and mental tiredness for the last 10 years, and he lost control of walking, and he lost the speech, and his speech became slurred speech, and his gait became unsteady, and almost he was bedridden because it was a slow virus infection, and he all the neurologists and the modern medicine treatment could not help him. And I happened to meet him, and I started giving him homeopathic medicines, and I gave him yeah, I could recollect it was a cupra metallicum, homeopathic medicine, cupra metallicum in high dilution, and this high dilution started improving him, and in the last 1 year time his speech became close to normal, and his gait became almost normal, and he could eat normally, and his neurological functions became close to normal. I can say he's improved more than 80% in 1 year time with a single homeopathic drug, cupra metallicum. It was given in highest dilution, 10 in potency in water dose. Very, 1 or 2 pills are being used in a 2 months prescription, where a bottle of 2 ounce liquid of water and alcohol mixed with 2 pills of the drug, 2 pills of the 10 homeopathic dilution, and that dilution is doing marvelous result in that patient.
Dr. Rajendran, some of my colleagues say, well, if homeopathy actually works, then they would have published about it. Why aren't they publishing? What do you say about the case?
That's a wonderful question, because every time people say they are not publishing, there are many papers published in all these areas. Everybody read what is the area of their interest, and they don't read anything from outside the area of interest. And they say, I didn't read anything. That is the problem with who is saying they didn't read anything. Because, there are more than 100 research papers published by Professor 𝐃𝐫𝐁 and others. They are geneticists and they are molecular biologists, and especially Dr. 𝐃𝐫𝐁, Dr. Ramdasan Kuttan, Dr. Sunila, and many others. And they published research papers showing the clinical efficacy of homeopathic high dilutions in various cancer conditions. And there are many clinical papers. I have published a paper in British Homeopathic Journal in 2002, case histories of 30 cases of molluscum contagiosum, which I did as a research project in 1991 to 94. And 30 cases of molluscum contagiosum was published in British Journal. Like that, so many publications are coming. And if you don't believe, if people start thinking it is a placebo, then you won't look at anything. You say it is okay, it is a placebo. And that's an attitude problem. That is more than a scientific issue. It's an attitude problem, as far as I think.
Can you mention the name of the doctor that you said is publishing the papers? The one you mentioned?
You mean the research papers?
Yes, you just mentioned the doctor's name.
Yeah, Professor 𝐃𝐫𝐁. Professor 𝐃𝐫𝐁.
Yeah, can you type that for us? There's an audience person that's asking for the typing spelling of the name.
Where I should do that in the down question and answer session?
Yeah, there are over 400 papers that have been published in the medical literature. They can be found in several different books by not only the speakers here, but by some of the more prolific authors of homeopathy. I mentioned the name Dana Ullman before. He was one of the teachers when I studied homeopathy in the United States several years ago. And I will direct any of you who are interested to write to us, and we will send you to the kinds of papers that you need. There's also another doctor who has been gathering a lot of papers on homeopathy in something called the Virtual Health Library of Traditional Complementary Integrative Medicine, which is called TCIM. So it's the VHL, Virtual Health Library of the TCIM. And she has been compiling these for the last, I think, 5-7 years. So you can also go to that resource. So for any of you who are doubting that there are papers, certainly there are. So this takes us to our next thing, which you, Dr. Rajendran, you mentioned. Why is it that the group of people who say that homeopathy doesn't work don't see it? Is it only that there's a kind of tunnel vision and people only look at what they want to? Or is there any other issue? Dr. Ratin, can you address this first?
Definitely, it's a very nice question. Look, many people, they adjudge homeopathy with a very preconceived idea. You know, the science is not a static thing. It is always a changing thing. And basically, the which was not explained earlier, that how these high dilution, not only high diluted, we are to mention here, homeopathic drugs are highly potentized, succussed medicine. It is not only diluted. So how these highly succussed and how these highly diluted substances, they are prepared, what is their nature, about the pattern recognitions of these substances. Previously, we won't have any idea in the previous decades, like in 90s, even in 2000 also. But gradually, with several research works and several publications that has pointed out, yes, the homeopathic potencies are definitely, they are not placebos, like even Nobel laureate Professor Luc Montagnier, who was the founder of the AIDS virus also, discoverer of the AIDS virus. He also mentioned that yes, the homeopathic potencies are different from the placebos. And then a lot of studies came forward. Now these informations, I think, are not, uniformly, it is not known to the people who are doubting about homeopathy. This information must have to reach the persons who are doubting about homeopathy. The papers, the publications, these informations must reach up to this level. And there is a sharp difference between these students from the modern schools and with the other schools like homeopathy and from the other streams. Here, if the informations really can reach to these people who are studying even at the basic level in modern medicine school, I think they will also develop the interest of knowing about what is happening over there in highly diluted, highly succussed substances over there. And we have also seen that these highly succussed substances are capable of addressing the gene, and it can definitely it can upregulate and downregulate the gene expressions of different conditions. So these informations, I think, require to be circulated largely. Otherwise, this doubt and this confusion will remain for long.
Thank you, Dr. Ratin. Dr. Jayesh, can you talk a little bit more about the epigenetics and how homeopathy is affecting the epigenetics of the DNA?
So I didn't get it.
Oh, sorry, I'll say it again. The epigenetics that is being affected by homeopathic remedies. Can you hear me? Oh, you can't hear, sorry. Problem with my microphone. I'll move on to Dr. Rajendran and we'll come back to you, Dr. Jayesh. The epigenetics that are affected by the homeopathic remedies. Dr. Rajendran, can you talk a little about that?
Yeah, Bhaswati, thank you. That's a very, very important area. We have to think seriously in the future of medical science itself. Epigenetics is one of the research area where some of the world famous researchers did wonderful job in the last 20 years. And that also the primary work was being done by Professor Kuda.
So your voice has dropped out. We can't hear you, Dr. Rajendran. Dr. Rajendran, we can't hear you. Dr. Rajendran? Hello, Dr. Rajendran, we can't hear you.
And also switching on, switching off of the genes and also many other mechanisms are activated in the immunogenetic modulation. So homeopathic ultra-high dilutions which contain nanoscale materials, and these nanoscale materials are basically close to less than 10 nanometer size in almost all metals and minerals. And they produce epigenetic modification, and this epigenetic modification produces immunogenetic modulations, and this immunogenetic modulation leads to the curative pharmacodynamical action of homeopathic dilutions. And this is well proved. Anybody can go through the research works of Professor Kudabaksh in epigenetics and homeopathy. They can find many papers published in very prestigious peer-reviewed international journals. And this research work, when you integrate with the result of homeopathic practice, that shows the efficacy of homeopathy as a therapeutics, which is immunogenetic drug modulation based on the nanostructures of homeopathy. Compared to the biomolecular medication, it can be considered as a deeper perspective in the human existence. Thank you, Dr. Bhaswati.
Yeah, and can either of the three of you talk about the memory of water? We always hear about how the water, either through hydrogen bonding or some kind of chemical or physical or energetic measure, the memory of water. What is that?
In fact, I didn't do any work in that area. So with my limited knowledge in that area, water memory was a theory which came 2 decades back to support the homeopathic drug action, and based on the belief that there is no material content in homeopathic ultra-high dilutions. But after 2010, enormous research happened in the electron microscopy has shown that there are definite presence of nanostructures of the original drug substance in all high dilutions. So my point is basically it is fundamentally a nanopharmacological action of homeopathic drug, but at the same time we cannot exclude the water memory part of homeopathy drug action, not only in homeopathy, in many other aspects, because that science has to grow, because water structures are showing many variations when they are going through different process of succussions and when they are exposed to different nano level contents. So I believe fundamentally based on my research that the nanostructures are the basic on which homeopathic drug action happens. But at the same time, I don't want to exclude the possibility of water memory, which may have a definite impact, which I don't have a clear back end to talk a final word about that, but I don't want to exclude it.
No, thank you. Dr. Jayesh, would you like to add anything about the memory of water?
I'm sorry, my experience also is very limited on that.
That's okay. We're going to talk about something you like very soon. Dr. Ratin, would you like to say anything about the memory of water?
Yes, actually, I share the view with Dr. Rajendran. It came 2 decades back. Professor Benveniste of France, he first worked on this area, and he actually also showed about the degranulation of the basophil molecules over there. So basically, that idea cropped up from there. But as I have mentioned, that science is not a static thing. A lot of research works are going on, and a lot of new ideas and all these things are coming up. And now we are more banking on the nanoparticles and nanostructure. This is actually what is happening in current present science.
Thank you for contributing that. So, when we talk about does homeopathy work, in the beginning I talked about the political, shall we say, backlash, or shall we say unwillingness for the other systems of medicine to understand it. I still have people who say they're very interested in natural medicine that ask me, what's the difference between Ayurveda and homeopathy? Is there any difference between naturopathy and homeopathy? Is homeopathy a herbal medicine? There's a great amount of ignorance. And that ignorance extends to people who make large decisions for large groups of people. So between them, and then there are government officials and people who run the healthcare system, whether it's on a regional, a state, a national, or an international system. And homeopathy does not seem to get the kind of usage that it could. So I'd like each of you to comment on that, with me starting with a story. And the story is that I've also been reading about homeopathy for the last month. And what I came to know is that Hahnemann, in the 1800s, when he returned to Europe, was using the apothecaries to get medicines. And that at that time it was in powders, it was not in pills. And he was using very small amounts. And the apothecaries didn't like it. The apothecaries were the men that carried these different medicinal powders. And so the laws in the land were changed so that you had to use only apothecaries, and they didn't like Hahnemann, so he was sent out and he moved to a different hamlet, a different shire. And he found that people were starting to push him away because he was practicing medicine without using enough of it. So he started working with royal families. And over the course of his life, he worked with over 200 royal families, the most famous of which today is the English royal family. So that family, we all know, those of us who are in the business, in fact, some of us talked about it today, we all know that Prince Charles took arsenic album and rust tox when he first came down with symptoms of COVID. We all know it. And yet he was not allowed to speak about it. He was not allowed to declare it publicly. He was required to keep it quiet. So with that as an intro to this gentle political problem that we have with homeopathy being recognized and the AMA denouncing homeopathy, can any of you like to talk about why homeopathy is kept suppressed? Who would like to go first? Dr. Ratin?
Yes, you are absolutely correct, Bhaswati. Basically, look, whatever newer ideas comes in the world, that is opposed by a group of people. If we see Galileo, when he gave his first idea about rotation of Earth and rotation of different planets, his idea was badly opposed by a group of persons. Whoever give you some new ideas, new thinkings, definitely the conservative liners definitely give a lot of resistance to these things. And in fact, I think there is a misnotions of some of the people that if suppose homeopathy comes up, the allopathy will go down. If something will come up, this will go down. I think this is absolutely a rubbish idea. It is not a boxing ring. Basically, we require a complementary approach for to giving relief of the patient. I think there are a lot of conditions. I am mentioning one condition. You have last question you have asked to Dr. Rajendra, that can you say something about incurable, which is incurable by allopathy. Basically, she is my relative. She was born in SSKM Hospital, Calcutta. And a few days after his birth, she was diagnosed as neonatal alloimmune idiopathic thrombocytopenic purpura, NAITP. And there the platelet was going down. Then the pediatrics, they decided to give her platelet, but they were giving platelet, but it was not stabilizing because it was not going up to more than 40,000, 50,000. Again, they were giving platelets. Anyway, the initial giving platelets and the support saved her life, but that was not carrying on because when after giving platelet, again it was coming down, again it was coming down. And the family was totally perplexed to what to do at this moment, that giving so much of platelet, after spending so much of money, still the life of that baby is at stake. Then somehow they landed up to me, and I analyzed that case. And so far I remember, I used phosphorus. And phosphorus, there is another scale, not centesimal scale. It is called millisimal scale, which is more finer. I use the millisimal scale phosphorus, gradually 0/1, 0/2 in this way. And within 6 months, I have got all records of that case, that now the baby is around, say, 1 year. For last 3 months, she doesn't require any sort of platelet transfusion. and her platelet level is maintained around 2.5 lakhs, something like that. So I think here the combinations of the homeopathic and allopathic system saved the life of that baby. Here it is not a boxing ring, but something I think still the opposition is coming, what you have mentioned, since time immemorial, from Hahnemann's time, everybody is thinking if homeopathy comes up, all the antibiotics, all the other things will go down. There will be a big backlash with the homeopathic system. If comes up, will be in the antibiotic system, in the other area where pharmaceutical industry has poured money. I think this is a rubbish idea. Let the fresh air must flow.
Yes, thank you very much. Dr. Jayesh, can you talk a little bit about the scope of homeopathy as opposed to allopathy, as Dr. Ratin just started speaking about?
So also to talk, sure, Dr. Bhaswati, also to talk a little on, what prevents homeopathy from being recognized the way it ought to. Can I add a little on that? There are multiple factors, and one of it is homeopathy so far was always considered unscientific, because in simple language, the more you dilute, more the power, and modern science could not accept it. Now, even though it has been proved through nanotechnology and by molecular biologists and geneticists and all that, on how this is possible, still there are, unfortunately, it is like having people with, a horse with blinkers. With the horse feels, this is my world. It doesn't realize that there is 80% world beyond. That you make a little effort to look. So one side is the non-acceptance, in spite of there being a scientific proof now. Yet many of the countries have debarred homeopathy. Australia, recently France, where homeopathy was so prevalent. New Zealand, Switzerland, England, UK, where homeopathy was prevalent. So one side, and then the other side, there is another reason why Dr. Ratin said, there is the other side to it where people are afraid that they may lose their hold over this healthcare system. That goes at a much larger level, where the ministries and governments are also in the hold of powers that be. So
they're losing their home, or do you think there's another reason why they can't possibly let homeopathic clinical realities come to light? Why they have to keep it suppressed?
Sorry, your voice is breaking. Sorry.
Oh, I'm so sorry. I'm saying, do you think that it's only that they will lose their own home, or do you think that there's any other reason why they want to suppress homeopathy and make sure that homeopathy is not going to be seen as the useful medicine that it is?
See, even though homeopathy is the second largest, as per WHO, homeopathy is the second largest practice of medicine on earth, alternative medicine on earth. All right. But the other side to it is that people's and the huge medicinal organizations and all feel threatened. If alternative medicine, I don't mean only homeopathy alone, homeopathy, Ayurveda, if they get a stronger foothold, then it is a threat to a huge, gigantic, multi-billion industry. I'm talking of a very different science. We all know about it, a concept. And they have, like I said, right from the governments of countries in their hands. So a lot of things which ought to be does not happen because of these powers to be. And for that, any amount of scientific explanation or scientific proof also is prevented from being accepted by, through various excuses by these people.
Thank you very much. Dr. Rajendran, what do you think is keeping homeopathy from being as well recognized as it could? And why doesn't allopathic medicine give it the respect of clinical efficacy that it seems to be showing in patients?
Yeah, Dr. Bhaswati, this is something which is a little bit of partly scientific problem and partly political problem and mostly economical problem. I consider it like that because homeopathy brings a new concept into the human health and treatment, which was not in consonance with the existing mode of thought of the conventional medicine. And another important thing is the science become, the health became a mercantilized or a commercialized or a more of a profit-making industry rather than a health care. Healthcare, we say as a general term, at the same time, it is more of a health industry, and it is a profiteering, which is what people are looking for. So in that point of view, homeopathy is definitely not an attractive option, because when you dilute medicines, when you use such as small particles, and when you treat the patient, the cost is negligible, a negligible cost. Dr. Ratin was telling about one patient of thrombocytopenic purpura, where he treated and cured. So what is the cost involved in that? It is negligible. Whereas if you get admitted in a hospital for months together and going through the procedures, the cost is very high. So the industry which is running the show, let me talk very frankly, we doctors are not running the show of health science. The health science, the show is run by, and the decisions are made by, and it is being implemented by the industry, which is basically commercial. And none of the industrialists who is heading the pharma industry or vaccine industry is a doctor taken oath as a Hippocratic oath of purity, but they are sworn to make money, and the basic interest is where the profit lies, and if there is something which prevents or reduces the profit, how to kill it. And that is a simple logic which is going on in the world. And I'm really afraid in that process, the so-called institutions like World Health Organization or FDA or CDC, which we all revered as the great human protectors of human health, are being used in the commercial purpose. And nothing happened positively, because you know that millions of people got cured around the world every year with homeopathy. Even in viral infections, 10 years back, in our state of Kerala, there was severe outbreak of dengue fever, and a lot of people had gone with low platelet levels, and they were going for transfusions. And even then, such people, finally, most of the people, a large number of population shifted to homeopathic treatment, and homeopathic doctors did a marvelous job by giving homeopathic medicines. And I myself treated many patients of reduced platelet count with severe symptoms of dengue fever. And 1, 2, 3 medicines are improving the patients and improving their platelet count within a couple of days. And one of the drug was Bryonia alba, and the second drug was Eupatorium perfoliatum. But one drug I have seen consistently increase the platelet count within 3 to 4 days was X-ray 200. X-ray is a homeopathic drug in 200 dilution. I have seen it in so many patients. But even the government of Kerala is aware of the effect of homeopathy in viral infections, because we have enough evidence. But when the corona case came, and when the corona problem started, and you know that initially the WHO declared there's nothing to worry about it, because it is not spreading from man to man. It is a zoonotic disease, but it is not crossing over between human being to human being. But later they changed their stand by the mid of January. And again, when the protocol came and when they declared it is a pandemic, they have not given any option other than what they wanted the people to do. So the individual doctors have completely lost their freedom, and individual patients also lost their freedom. Here is a big question of the human rights and human freedom is coming up in the name of health science, which is not a completely proved science. Because when the virus came, we people started crying it is a cytokine storm, and the cytokine storm is so dangerous, and it produces immediate respiratory distress. You need large number of ventilators. For what? Now we are not using that many ventilators anywhere in the world. Why it is not allowed to use Ayurveda or homeopathy in the beginning? Not given a chance. When the ministers wanted to give a chance, WHO guideline was not allowing them to do it.
You're right, but tell us about what the government officials quietly did to the three of you. I know stories from all three of you, about the government officials quietly under the table what they did. Can you reveal anything, or should I say it?
Ma'am, actually, I don't have any evidence to talk about the government officials have done something, but I can tell you one thing very clearly. The majority of government officials, they are not doctors. They have the social prejudice, common social prejudice. And it is always safer for them to play under the rule book, which is as per the WHO, it is a guidelines. It is a protocol. Why should they take the risk? Even the political leaders, they're convinced about homeopathy, could not take a risk because it is a risk they don't want to take.
Yes, you're right. You're very right. Dr. Ratin, can you talk about what actually happened with the government?
Absolutely correct. Dr. Rajendran is absolutely correct. Most of the government officials want to go in a copybook style, nothing more than that, because they want to save their skin. If they go and take something else decision, but I think there were some courageous people in 1970s when Dr. Jainal Abedin, he was the health minister of West Bengal. He took the decision that yes, the cholera epidemic should not be treated only with the allopathic system of medicine. Let the homeopathic Ayurvedic system come in front and to take a decision. That is why homeopathy is established today. And at that time, Dr. Jainal Abedin like person was there in the West Bengal Health Ministry who took a decision that yes, allow all the system to come in front and to serve the people. I think nowadays we are lacking these bold persons in the administrations and in the political fields.
Bold persons are missing. One of you actually told me that a government official came to you and said, we want 10,000 doses of this particular medicine that we've learned is being used successfully for corona. We want it for our own. We can't officially declare it, but it is there. So I know that it's difficult to say it out loud, so I am going to say it because I have nothing to risk. Dr. Jayesh, can you talk about anything that you'd like to say about the political side of why homeopathy is being suppressed?
Actually, I don't wish to name the people, but some of the top politicians sitting in Delhi are taking homeopathy. Personally, know very, very well. I've given some of the top people are taking homeopathic preventives repeatedly. But when it comes to accepting it officially, there is a lull. And, there was a bold lady, she was the principal secretary of Gujarat Health Ministry. She openly declared that homeopathy and Ayurveda given to n number of people proved far more successful as an immunity booster or preventive. But after that was the initial stage of corona. The last 3-4 months, we don't hear about her. So sometimes people, very bold people, get silenced.
We know about that very much.
I think in our state of Tamil Nadu, it took us 4 months to get the government to accept a simple immunity booster for the people. When they discovered that modern medicine has no answer at all, in spite of that, it took us another 2 months to convince them.
Yes.
So there is politics. There is these powers to be, like I told you earlier, these powers to be have everybody under their thumb, and that is what in Kerala also. Again,
it's the next step forward in order for homeopathy to get not just a name, but to actually help the people, which is what it was designed for, to actually help people who are really suffering from diseases and they could really use homeopathy in their lives. What's the next step, Dr. Jayesh?
See, personally, I feel we need to see what is individually, where you work individually, you have your own fan following and the people, word of mouth, people spread the word, the cures that you bring about, homeopathy bring about. But the other side, now that has limitations. What I personally believe is that if politicians do not, if it doesn't work out with politicians, we need to reach out to some of the big intellectual and corporate heads who have money power. And a lot of them are believers, big believers of homeopathy.
That's a great point. Thank you. Dr. Ratin, what do you think is the next step ahead?
I think the future of homeopathy, Ayurveda, and the natural system of medicine is very bright, brighter than modern system of medicine. Now, gradually, the people of the world is tilting towards this system of medicine. And in coming days, the genetic and other sciences will back up this system to be in the driver's seat.
Dr. Rajendran, what do you think is the next step?
One more thing just I wanted to say about that. when the government of Ayush Ministry has declared arsenicum album 230 can be given for as a immune booster for corona infection for the healthy people. There was a lot of opposition saying that it is placebo, nothing in it. But let me tell you one thing. In 2016, I studied arsenicum album 200 as a part of my electron microscopic studies, and I have published it. This is there in my book actually. And arsenic album 200 contains millions of nanoparticles varying size from 5 nanometer to 63 nanometer size. And a micro drop contains millions of nanoparticles. And the size of coronavirus is 100 to 150 nanometer size.
Yes.
So arsenic 200 nanoparticles are much, much smaller than the size of coronavirus.
Thank you very much. So science is going to bring homeopathy to light, and then we're just going to have to wait for the people who say they wait for science and say they believe in science and show whether or not they actually believe in science. We are at the end of 60 minutes, and so I want to thank all of you, Professor Dr. Rajan, Dr. Chakravarthy, Dr. Sangvi, and we are going to continue with our after show. So we'll just give a pause for the technical people to put a break here. I thank all of you for joining us. If you would like to sign up for our next Ayush Hard Talk, you can go to the same registration page that you went to, ayushvalley.org/hardtalk, and you can sign up right now for the next session, which will be on the first Sunday of December, which is December 6th. Please do join us then. And if you have time, stay with us now, and we will continue for an after show with myself and Dr. Thangavelu. Thank you for joining us.